carnivore diet. It sounds like it's maybe a take on like a keto type diet. These wearable sort of devices that you're talking about, there's obviously a tremendous amount of interest in this because you can get important information about your heart rate.
Welcome to another edition of Insight Podcast, and today we have a very exciting guest, the one and only Insight's own Dr. Umar Shakur. Dr. Umar is a non-invasive cardiologist. He is also the chair of cardiology and dedicated to improving cardiac outcomes in Bronzeville and beyond. He's also an expert in non-invasive cardiology. Dr. Shakur has a special interest in cardio-oncology, which involves management of cancer patients at risk from cardiotoxicity from chemo and immunotherapies. Dr. Shakur has trained at Medical College of Wisconsin for internal medicine, a chief medicine year at Brown University, and cardiology at St Vincent Hospital in Massachusetts. Without further ado, I'd like to bring Dr. Shakur up. So, Dr. Shakur, how are you doing?
I'm doing well. Thank you. Thanks for having me.
Yeah, thank you so much. We appreciate you making time for us today. You're our second guest for the new podcast we've started here at Insight, and we're very excited to talk all things cardiology. So, before we go into the meat and potatoes of the interview, could you give us a little bit of background on yourself before you went to medical school, and then also transition that into why did you choose cardiology as a specialty?
Yeah, of course. I actually grew up in the Chicago suburbs. I always joke I did everything from kindergarten until med school within 30 miles of my mom's house. And then when it came time for my medicine training, I did end up going to Wisconsin and eventually ended up in New England. My wife, who's a physician, had a chance to train at Brown University, so we took advantage of that. And what was supposed to be a short trip to New England ended up being a 13-year adventure. So we'd been in New England for the last many years. And so joining Insight was really an exciting opportunity to come back home and to be part of the wonderful mission here to restore cardiac services to the community and hopefully push things forward in new and exciting ways.
So why is it that you've decided or dedicated your studies and your interest to cardiology specifically? Like, what is it about the heart that resonated with you when you were in school? And then what opportunities exist in our local area?
Yeah, it's funny. I think the heart is something that resonates with me both in terms of science and physiology, but also let's say metaphysically, or and interestingly, I was an English major in college, so there was a lot of parallels between the heart and different and its many different let's say levels or kind of attributes. And so eventually, I think for me, what's most exciting about cardiology is that you get a chance to make a long-term relationship with the patient, and you get to see them through both the acute care, whether that's in the hospital, and then transition usually into chronic care into your clinic. So you get the excitement of sort of hospital management when people are having heart failure or having a heart attack, and then you often from there form lifelong bonds. The other thing is that cardiology is very technologically advanced. There's always new treatments and therapies that are coming out, whether we're talking about procedures or medications. So it's an area where there's a tremendous amount of research and advancement. So I think I enjoy that aspect of it, that it always feels like you're on the cutting edge of new technology and new innovations. So that's excitement. I mean, it's both the acuity of care, the long-term care, and sort of being at the cutting edge of the developments in your field.
That's one thing I never really took into consideration. You said that you get to be with the patient. It could be maybe even decades, right? So would you say when it comes to heart health, what are the primary factors that contribute to one's health, either being healthy or not healthy?
Yeah, so I think a lot of times, it's important to begin with kind of the basics and take stock of your family history. For instance, find out what's been going on with your parents, your siblings. The holidays are a good time to kind of capture that information if you don't know it, because that can sort of begin to set your risk for heart disease. And then a lot of heart disease is really due to certain risk factors. For instance, high blood pressure, high cholesterol, certain habits, for instance, like tobacco use, alcohol intake. And so, what I like about cardiology and cardiovascular health is that you really have to kind of take a look at your whole health. It's a field that sort of integrates a lot of different things in order to help people achieve good health. You need good nutrition, you need regular exercise, you need control of things like diabetes and blood pressure, and so you have to integrate all of this different these different aspects into what we call kind of a heart healthy lifestyle. And I think that that's one of the most important things when you're considering your heart health is what are my risk factors for heart disease? How well are they controlled? And how's my lifestyle? Is there room for improvement in terms of diet, exercise, and have I looked into my risk factors? For instance, if you haven't checked your blood pressure, how do you know if you have high blood pressure? If you haven't checked your cholesterol, how do you know if you have high cholesterol? So I think the nice thing about cardiology is that a lot of our risk factors for cardiac disease are what we call modifiable. They're things that you can reduce your risk if you take the right steps, to improve your health.
So let's go right into those right steps, right? So obviously, family history is important, meaning genetics, and then also your lifestyle that you're living, what you're eating, if you're exercising or not. So based on your time in your career in this field, what are some of these simple things that the everyday person can do to ensure that their heart is healthy?
Yeah, great question. I mean, there's a lot of actually good programs that are out there that can help guide people. For instance, the American Heart Association has something. It used to be called Life's Simple Seven. I think they updated it now to eight things you can do instead of seven. But that's actually a place where I often tell people to start looking at, and basically it has to do with making sure you have regular physical activity. We live in a time and an age where physical inactivity has never been more prevalent. Because of the kinds of jobs we have. You can. Many people can just sit at a desk, all day, and we're even at the point now where we have to tell people that you need to stand more, because we're just so inactive that even the act of standing has become something that we have to recommend people do, which if you think about it in some ways is kind of like crazy, right? That we're at that point where we're talking about, what, it's good if you stand, like really stand, you'll be healthier, and but that's where we're at as a society. So I think physical activity is really one of the most important things we can do to improve our heart health. Looking at our diet, if you look at the food chain and the food supply, there's so much processed food, so much fast food. So really taking a look at carbohydrate restriction, and favoring a plant-based diet, and one that, what I tell people is like, with diet, unfortunately, I wish there was magic, but really it should be more heavily plant-based, and it has to be calorie restricted. I mean, there's no other secret to it. You have to eat less calories, and you have to make sure that the calories you're getting in are good ones, and most of the good calories are found in plants. White meats are good too, but really you need to restrict things like red meat, soda, snacks, unnecessary carbs. It's hard to do. I mean, look, I'm a parent of three, and you drive past one fast food restaurant, and you're like, okay, we made it past. And the second one comes, and you're like, oh, we're going to keep going. The third one comes, and you're like, you know what? I didn't really prepare dinner tonight, so we're going to stop here. So, as they say, the struggle is certainly there. Yeah, struggle is real. So I don't, I'm not surprised why we have these problems in society, because we've structured the way we eat and the way we work in such ways that it doesn't promote necessarily a healthy lifestyle. You have to make a very conscious effort to kind of buck the trend of being stationary and sedentary and eating healthy. So I think those are very difficult things. The other thing kind of along this lifestyle theme would be smoking. And honestly, from my perspective, any kind of smoking anything. So I tell people marijuana smoking is not okay, tobacco smoking is not okay, hookah and all these things. There's all kinds of things you can smoke nowadays. It's much more sophisticated than when I was a kid, and none of it's good for you. If you're smoking it, it's not healthy. I mean, basically, uh, so I think that's a big area where we need to focus our efforts. And then I always tell people alcohol restriction is another big one. There's no cardiac study that shows benefit. People always try and get me with red wine. And actually, the benefit is in red grapes. So I tell you can get all the benefits of red wine by eating red grapes. And my patients will often say, "Well, that's not fun." And not everything is. So, uh, but uh, but I think that those things are definitely health positive things you can do. And then getting into the more sort of medical things. Things like high blood pressure and cholesterol. I mean, that's something that you can get checked via regular primary care visits. Many times, we don't treat high blood pressure seriously, or people will come into the office and they'll tell their primary care, "Oh, I'm stressed today," or "I forgot my medicine today," or meanwhile, their blood pressure is like 150s, 140s for like years, and it never really gets better. So I think a few years ago, actually, the cardiology community got a little bit of flack for releasing very aggressive sort of blood pressure guidelines, which not all physician communities have sort of embraced and with the same sort of gusto. But I think it stems from the fact that in cardiology, we see the complications of uncontrolled or poorly controlled high blood pressure. And honestly, since I've been in this community, it's such a sort of basic problem, but it continues to be a very big issue for preventing cardiovascular disease and complications. The blood pressure, you'd be amazed. I mean, there's so much salt in the food supply that, just finding a way to restrict your salt is challenging. And then if your family history is such and your genetics are such, and you add, kind of liberal salt intake to that, very suddenly you'll see that you might end up needing 4 or 5 medicines for blood pressure, which nobody likes that. But I tell people the alternative is you're going to get heart failure, you're going to develop coronary disease, you're going to develop these complications that you don't want, stroke. So I think that's very important. And lastly, I would say cholesterol. Many times I feel like people are very relaxed in their approach to managing cholesterol. And I would say, we do have some good risk tools that are out there, something called the ASCVD score that you can use to estimate the risk of your patients for heart disease. And calcium scoring has also come a long way in terms of predicting a person's risk for heart disease. So I think these are useful tools. But I'll tell you, a lot of cardiologists, especially in the preventative community, are very aggressive at looking at things like your LDL cholesterol and treating that. There's even a concept out there that some doctors follow called LDL years, which is kind of based on smoking years or pack year history that's used in tobacco, and it's sort of getting a sense of how high is your LDL and how long has it been that high in terms of predicting your risk for heart disease. So I think that being aggressive with cholesterol, we have very good medicines for it. There are many exciting new therapies coming out for management of cholesterol. That we on the market already, there are medications that injections you can take that are essentially twice a year once they're on the maintenance. It's almost like taking a vaccine for cholesterol. So it's pretty exciting. The innovations that are coming, and the treatments that are already available are so good. So I think that would be kind of an overall comprehensive way to kind of assess and evaluate your cardiac health.
You mentioned a lot, so much to unpack, so many thoughts that were circulating throughout my head. So there's a popular trend right now, and I would love to get your take on it, or maybe if there's a future study that's done on it, it would be excellent. But have you heard of the carnivore diet?
Yeah, yeah. Well, so it's interesting. Like there, yes, carnivore diet is. It sounds like it's maybe a take on like a keto type diet, which is like protein heavy, sort of diet intake. Um, and what I'll say about this about keto diets is that, yeah, I mean, they do work in terms of achieving weight loss, but one of the problems with like pure keto diets is that they actually raise your LDL or your bad cholesterol. So, so in that sense, I think it's a long-term strategy. It's not maybe the healthiest thing to do. I still tell people, to be honest, the healthiest diets are still what we would call plant-based diets. And combined with calorie restriction. Now, we can get into strategies for calorie restriction. You can either sort of count calories with each meal, or you can do intermittent fasting. So there's different ways to achieve calorie restriction beyond just what's on the plate immediately in front of you. But I think that generally speaking, I mean, I'm not a huge fan of the pure keto protein only diets. I will say in general, most of us probably um, could increase protein intake, because a lot of us are, if you looked at the average person's intake of their diet, it's carb heavy, So shifting to protein has caught on in popularity because people like meat. And the assumption is that you're going to reduce the amount of carbs that you're taking in as you're switching to protein. So and that's why you lose the weight, because basically your carb intake is cutting off, is dropping down dramatically. But again, like, the type of meat matters. So it should be white meats, and red meat. I would not recommend, even if it's part of keto. And honestly, probably the safest sort of meat based diet is Atkins. I would say that has stood up maybe a little bit over the time, in terms of its heart safety. But DASH diet, plant-based Mediterranean diets, plant-based diets, generally speaking, are going to be safer and better for your heart long term.
I don't know if you remember some years ago, about 10 years ago, there was this individual. He's the creator of, you remember 5 Hour Energy, that energy drink?
Yes.
And he's from Michigan, and on YouTube, his documentary was very popular. And one of the devices he created was that, like, leg compression device, where when you go to bed, you wear these leg compressions socks over your legs, and then basically that takes over some of the responsibilities for your heart while you're sleeping. And the idea, I guess, behind it was that it takes years off of your heart, because, or it adds years to your heart, because it's taking the responsibility and the primary job over. So any thoughts on something like that in terms of just future technologies and medicines?
Yeah, that's interesting. I mean, I you can sort of see, the interesting thing about these types of technologies is they sort of take something that's maybe common sense, and they sort of try to, augment that, right? Like, oh, if you're, it's hard to get the blood down to the legs and then from the legs back to the heart. So maybe if you help it out, it's going to help you. Is it the fountain of youth? No, I don't think anybody is necessarily going to live longer, because they're wearing these compression stockings. Honestly, I'll tell you, we use compression stockings pretty frequently in our practice, for a variety of reasons. Most commonly, people have something called chronic venous insufficiency, which is basically the veins in our legs as we get older. They have little valves in them, and they kind of become incompetent, meaning they don't push the blood back up towards the heart as easily. And these things can be worsened by other medical conditions like diabetes, which damages our blood vessels, especially if your sugars are high. By weight, obesity is a big factor there. Lack of activity is a big factor. So if you don't have good muscle tone in your legs, then there's no muscles to help push the blood back up towards your heart. So I think, those things are all there. So, for an average person, will wearing compression stockings or some kind of compression device be helpful? Honestly, it probably won't hurt unless you have some other medical condition where that kind of compression would be harmful, or if it broke your skin or caused cellulitis or something like that. But short of considerations like that, yeah, I mean, I think a little bit of compression for most of us, again, not because of our, I would say, less than healthy habits, it's probably helpful. But is it a game changer? Like, should all of us be doing it? I don't think so. I mean, you could achieve that with kind of regular aerobic exercise, good muscle tone, things like that.
So I'm going to give a quick recap. So in terms of, we did bring up that in our local area where the hospital is based, I believe one of the leading causes of death is cardiology related issues, heart disease, etc. So you mentioned more balanced diet, introducing more vegetables into the diet. You also mentioned fewer calories. So maybe whether that's through just eating less calories or doing time restricted eating, perhaps like fasting. You also mentioned the importance of exercise. Um, you also mentioned the importance of cutting out some of processed foods, fast foods, sodas, etc. You mentioned the benefits of removing any type of smoking. So, in a nutshell, these would be some quick ways of improving heart health.
Yes, definitely. And of course, seeing your doctor. we can we can help you through that process. I mean, one of the most rewarding things about practicing here is just seeing the way the community has reacted to having cardiovascular care back in their neighborhood, and having sort of specialists or people to talk to about these issues, and maybe getting more aggressive care on these issues, which it's not easy. I mean, as you've seen, like I can talk about any one of these topics for a little while. So you can imagine, like, if you're a primary care physician, you're trying to also schedule a person's colonoscopies and get them, they're having vision problems and X, Y, Z. I mean, you might not have the luxury to discuss these issues in more detail, and so I kind of view us as being an additional tool, that's available to others in the area, other physicians or providers that need help getting patients to achieve these goals in terms of blood pressure, cholesterol, lifestyle. But I think that's this is very exciting. Another thing that's pretty exciting is there's new medications out that can help with weight loss as well, and it's really changing a lot of the discussion around that. So a medication called semaglutide. It goes by different brand names, but there's been a lot of interest in it, even in the mainstream media, about how it can help with weight loss, and it's probably safer than a lot of the medications we've used before. So, all these are great tools that are available, and your physicians can help with, achieving weight loss and sort of a healthier heart lifestyle. I think that's kind of important. I mean, to me, of course, medications and interventions are useful and necessary for many people, but a lot of times, a lot of my conversation with my patients is around, are there things we can do with your lifestyle, to change it around? And you'd be surprised. Small changes that are consistent go a long way. As little as 5 minutes of regular exercise. People like we, I mentioned, I kind of was joking earlier about standing, and we're at a point in society where we're talking about the health benefits of standing. Well, they have studied exercise down to as little as 5 minutes a day, because we're just so sedentary as a society that people have actually studied whether 5 minutes of exercise makes a difference or not, and the answer is it does. So the amazing thing is, you don't need to do a lot. You just need to do a little and be consistent. So, something that, especially my patients who are maybe a little more mobile, there's something called the 7-minute workout, 7-minute workout that was popular a few years ago. and I still recommend it to people. It's literally 7-minute workout, and if you did nothing else in your life, it would at least give you kind of a baseline sort of bare minimum of fitness. And I would say 99% of the exercises in the 7-minute workout don't require gym membership or special equipment. So, and you can Google it. There's apps on smartphones for it. I mean, it's kind of a well-established product out there. So these are things you can do. You don't need a Peloton. You, you don't need a fancy gym membership. You can do these things, without all that.
Awesome. So you mentioned earlier, the role of preventative medicine. So I'll give you a patient avatar, right? Somebody who's in his mid 30s has a family history of various heart issues. So for example, maybe a family member died from a heart attack. Maybe a current family member is experiencing various heart-related issues. So if this person is in their mid 30s, looks relatively healthy, would you advise them to schedule an appointment with a cardiologist because of the family history and just start tracking some data, getting some data from blood work and different scans and exams and whatnot?
Yeah, so that's a great question. I mean, 30s, the good thing is, youth is powerful medicine. I always tell people. So, in other words, you get away with a lot when you're young. So, what's the chance that a 30-year-old is really going to have any significant heart disease, or somebody at 35? It's pretty minimal, even if they have strong family history. And honestly, even if they have some of these other conditions like diabetes, high blood pressure, quote unquote, they'll get away with it, because of the power of youth. But of course, that's not a winning long-term strategy. So a lot of times, what I'll tell younger patients even is that, sure, you might be getting away with uncontrolled diabetes, uncontrolled blood pressure, uncontrolled lipids right now because you're young. But hopefully you want to get old one day, and hopefully, when you're old is sort of when you need your health more. So because you want to retain your mobility, your independence, and your activity levels, when you're older. So you have to invest in that now, right? I mean, nothing's for free. So you have to put some time and effort into your health, starting in your 30s, 20s, and 30s. And I'll give you a perfect example. So in the past, believe it or not, pediatricians, they would never screen for things like diabetes or cholesterol because, people thought, well, kids, I mean, they can't possibly, have these problems, and so why would we screen for them? And even if we were to screen for them, why would we treat them? Because they're kids, so a kid is not, let's say, even if a kid has high cholesterol, he or she's not going to get a heart attack or have a stroke. And are we really going to put like a 15-year-old on medicines, So you only screen for things if you're going to treat them, right? Or if you're going to make a difference. So the interesting thing is because of things like video games and lack of sort of exercise and snacks, we're seeing obesity in young children in their adolescent years, and a lot of kids will just play video games all day and not do anything physical. So they develop not type 1 diabetes but type 2 diabetes when they're like 15, 16 years old. Now, imagine that you're 15 years old and you have type 2 diabetes. By the time you're 30, you've had 15 years of diabetes, right? That's long enough for you to start now showing up with the problems of somebody in their 60s with diabetes, right? Things like stroke, heart attack, and things like that. So now even pediatricians will start screening for these things. And usually their interventions are more focused on lifestyle change because, at that young age, you really can sort of intervene and convince people, hey, you got to get healthier or you're going to be stuck on medicines or you're going to be, in this and that way. And some kids, some teenagers and young adults do end up on medicines, but, appropriately if necessary. So sadly, yeah, we do live in an age where, in your 30s, you might not be as healthy as you think, especially if maybe some of these problems first surfaced in your teenage years. And so I think your point is well taken. I mean, it sort of depends on your situation. Now, let's say you're 30 years old, you have family history, but you're otherwise really healthy, you're active, you're going to the gym, you play in a sports league, and, you don't have any symptoms. Well, that guy or gal, you could maybe their primary care can keep an eye on them until they start to see any signs of like symptoms or blood pressure issues or cholesterol. I think, maybe in the 30s is, if they're otherwise healthy, it might be too young to be worried about it. Getting into your 40s, 50s, I mean, that's a different conversation. Then I think, starting to get more aggressive probably makes sense. And again, this kind of based on my clinical practice. I mean, the guidelines are kind of a little vague on this kind of younger age group. What do we do? Even those risk scores that I talked about, the ASCVD risk score, they don't even kick in until I think age 44, 45. So we don't really have great risk prediction tools for younger patients. But I do think, and I have seen younger patients like the one I described, where they've had like type 2 diabetes or they've had blood pressure issues and since their teenage years, and they show up in their 30s and 40s with these kind of problems. So unfortunately, nothing's impossible, and sometimes not in a good way.
So you brought up, predictive scores, and actually that leads me to my next question. With the emergence of like smart tools, so I'm wearing like a smart ring right now. It tracks my sleep, my blood oxygen, my heart rate variability, my heart rate while I'm exercising. It gives you like congregate scores, and it gives you like recommendations and tips. And now with the emergence of artificial intelligence, what's in store for cardiology?
Well, yeah, exactly. It's kind of an exciting new world when it comes to that. So, these wearable sort of devices that you're talking about, there's obviously a tremendous amount of interest in this because you can get important information about your heart rate, and we know that generally speaking, for instance, that if a person has a lower resting heart rate, they tend to be healthier, sort of like the athlete, athletic person, generally speaking, they tend to have lower heart rates than somebody who's maybe less athletic, and people who have other medical conditions, sometimes they have faster heart rates. So it's interesting that something as simple, in some ways as a metric as heart rate can give you some insight into a person's overall health. Now you start adding things like oxygen levels, then you start adding things like EKGs or blood. There's even a smartwatch that will do blood pressure monitoring, So I think that, in terms of giving a person a snapshot of their overall sort of cardiac health or kind of basic health, I mean, these tools are helpful. Why not? When they first came out, honestly, I used to not be a fan of them because the results from these wearables was far off. People would come in and tell me their heart rate was like 200 or like 170, and we'd get like an actual heart monitor, like a medical grade one, and their heart rate was like completely normal. And there was never any fast heart rates. So, but with the iterations and sort of the state of the art that's out now in terms of technology, I would say it matches pretty well, what we're using even in the office. So I think that there's a lot more to come in terms of how these, technologies will help us. The big problem is we haven't studied it in the way that we study things like drugs or even procedures. So there are companies that are doing things like that, and not to, but one of the smartwatch companies, for instance, is actually doing a trial with one of the pharmaceutical companies to study whether or not using their smartwatch to detect an arrhythmia can help us manage that arrhythmia, and specifically using a certain type of blood thinner. So, I think these collaborations are coming down the pike, and we're going to see a lot of these kind of collaborations in the future. These medical tech, mobile tech, wearable tech companies are doing some interesting, creative things. So I'm a fan of it. I know some people are less, supportive of these kinds of advances, but I think that if done responsibly in collaboration with the medical community and the patient, this could be exciting and improve health for people who might not otherwise access it or be interested in it.
Amazing. Thank you for that insight. And definitely the technology seems like it's getting more and more efficient and effective. And so my last question to you is, talk to us about this new residency program that we've launched at Insight Hospital. I know there's a lot of excitement about it, but could you break it down into simple terms? What is a residency program, and why is this important for us at the hospital and for our local community?
Of course, yeah. I mean, this is one of the things we're most excited about and proud of is that we have launched an internal medicine residency program. We're actively recruiting for our first class, which will start next year. So, and this was to the hard work of Dr. Rizwan Moinuddin and many others, Dr. Asim Saeed, who have worked very hard to sort of make this happen. But having said that, the teaching and medical education is at the heart of what we do here at Insight, and even without a residency program right now, we have medical students going through. But really, when we think about this institution that we're in, it's now obviously run by Insight, but anyone who's been in Chicago knows about Mercy Hospital, which preceded us, and it has a long history of graduate medical education and training many of the physicians that actually continue to live and practice in the Chicagoland area. So there's definitely a grand tradition of graduate medical education here. And it is our hope to not only restore it, but hopefully even exceed that in terms of reputation and excellence that we bring. And it's a tall order, but everything starts somewhere. And we're really excited by the people we've already interviewed. We're optimistic that this is going to be a great class. Internal medicine is the backbone of medicine, so we'll be training. It's a 3-year internal medicine residency program. They train for 3 years. After that, they can become internists or internal medicine doctors and practice in clinic and primary care, or they could be hospitalists and practice mainly in the hospital setting, or it can be the launching pad to further specialization into specialties like cardiology. We're very excited to launch this program because it'll be a gateway to many opportunities for our trainees.
Dr. Umar, thank you for your time. This was very helpful, very insightful, learning more about the heart and learning about ways to protect our heart, such a vital and important organ in our body. And if we wanted to get more updates in terms of what the cardiology department is doing or the tests that they offer, I'm assuming we can find those on the website.
Yes, definitely. You can come to our website. If you click from the main site, there should be a link directly to the cardiology site, also to the internal medicine residency program. And yeah, we're happy. My two colleagues here, Dr. Bobby Diniatis is an interventional cardiologist, and Dr. Neha Patel is a non-invasive cardiologist. And so we have growing department in cardiology, we're ramping up quickly. So we'll be offering a full spectrum of cardiovascular care for this community, and we'd be happy to see anyone who needs care.
Thank you so much. We're very grateful that you gave us from your time for our second episode, and we look forward to having you back on.
Sounds good. Thank you so
Thank you.
much.
Thank you.